Hi, I'm a program coordinator with the Upper Midwest Telehealth Resource Center, a program of the Indiana Rural Health Association. And today we're going to go over some updates related to telehealth coverage in the region for the second quarter of 2023. We'll be covering the basics of Indiana Medicaid, updates to Indiana Medicaid, as well as some pending legislation in Indiana as of March 2023. If you have any questions related to the contents of this video, please reach out to us at info@umtrc.org. First, we'll go over the basics of Indiana Medicaid. As of October 2022, nearly 2 million Indiana residents were enrolled in the Indiana Health Coverage Programs, or IHCP, a number of programs that provide coverage for those who are older adults, disabled, blind, pregnant, or otherwise eligible for coverage. The Indiana Health Coverage Programs, the IHCP, are housed under the Indiana Family and Social Services Administration, or the Indiana FSSA. Now we'll touch on some automatic enrollment changes. Due to the upcoming end of the federal public health emergency, federal legislation has dictated an end to automatic enrollments, and certain eligibility considerations changed during the COVID-19 PHE. Effective on March 31st, 2023, automatic enrollment provisions ended in Indiana. Full coverage IHCP members no longer have continuous eligibility. In order to maintain their coverage, they will once again be subject to the same standard member eligibility rules that were in place prior to March of 2020. At this time, the only coverage changes being made is to continuous eligibility, which was allowed under the federal PHE. Other Medicaid exceptions applied during the PHE, such as cost sharing, will be addressed at a later time. We'll go into further details on these changes on a later slide. In November, the Indiana Health Coverage Programs released a bulletin related to expanding the list of telehealth services that are covered when provided via audio only. The IHCP also clarified its parameters regarding skills training and development rendered via telehealth. Some highlights of this bulletin include, under audio-only expansion, the IHCP is updating the telehealth and virtual services codes set to allow additional services to be reimbursed when rendered via telephone or other audio-only telecommunication systems. These allowed codes are 99202, 99203, 99212, and 99213. You can see the bulletin for more information about specifically what these codes entail. Some updates related to skills trainings and developments include skills training and developments are being covered for members who have access to Medicaid rehabilitation option services only. But providers are expected to have the service parameters in place by December 9th, 2022, when rendering skills training and developments via telehealth. And those specific service parameters are: clients must be given an in-person option, clients must indicate telehealth as their preferred method, and clients must have documented informed consent upon receiving these services. In February, a bulletin was passed related to going over coverage related to the end of the PHE. As a result of the recently passed federal spending bill, the continuous enrollment provisions that the Indiana Health Coverage Programs have been following since March 2020 will end as of March 31st, 2023. So that date has already passed. This means that regular determinations of coverage will begin again, and actions to adjust, reduce, or eliminate coverage will be allowed beginning in April 2023. Some important highlights from this bulletin include the following information. So approximately 25% of IHCP populations are only receiving their current category of coverage due to federal PHE rules. For this population, they will remain in the same category until their scheduled annual redetermination date is due. These members will receive a reminder notice 60 days before their redetermination due date. So far as coverage renewal goes, individuals who were eligible without using any of the special rules related to the federal PHE will be subject to normal requirements starting in April 2023. If the member is requested to verify information such as a new job, they must provide documentation by the due date or their coverage may be terminated. The IHCP will not terminate coverage for any member without first asking them to confirm their information. So there should not be an end to coverage that the recipient doesn't know about. So it's important to note that as of now, no special guidance has been released related to the end of the PHE for telehealth by Indiana Medicaid. You can see CMS for more bulletins and guidance information, and we will inform you if Indiana passes or releases anything related to the end of the PHE, specifically for telehealth, before it happens. So as far as private payer goes, the largest private insurer in Indiana is Anthem Blue Cross Blue Shield. And any questions about private insurer coverage after the PHE should be directed to the insurer, as answers will vary greatly depending on state, the type of plan someone has, as well as the service being discussed. So questions related to the end of the PHE for private insurers should be addressed to those specific private insurers. There are numerous pieces of pending legislation related to telehealth in Indiana. A full list of these codes can be found on the Center for Connected Health Policies legislation tracker. A few that have either been introduced or have had movement recently are listed here. State Bill 190 amends the definition of prescriber for purposes of electronically transmitted prescriptions for controlled substances, overdose intervention drugs, and telehealth services and prescriptions to include physician's assistants. House Bill 1397 would adopt the Professional Counselors Licensure Compact, and House Bill 1001 is the state budget that currently has proposed that some funding be allocated to a women's telecare pilot program. So we will see if that goes forward as written. This year, the UMTRC will be sponsoring a track at the Indiana Rural Health Association's annual conference on June 13th and 14th. Please register today to connect with other telehealth professionals and to see some great presentations about trending telehealth topics, such as remote patient monitoring and artificial intelligence. You can visit our website at umtrc.org for more information today. If you have more questions, please reach out to us via email at info@umtrc.org or connect with us at any of the social media platforms listed on the screen now. Connect with the UMTRC to stay updated on all the latest in telehealth news, legislation, and policy. Thank you so much for your attention today.